Where are we going?
I don't know yet. We're kind of in the middle of nowhere.
Where are we going? Basically,
It's a surprise. Let's not get run over though.
Yeah, on the way.
we don't want to get run over. I think that's a vase.
Is it?
I don't know. It's a Tesla. I knew it's a vase. You know it's a vase because he pulled over like so. I said. So let's take a look at what a vase is doing.
Turn it and
See.
show him.
Turn it in to show him. Knock knock. Knock knock. Who's driving there? Yeah, he thought that I was probably a burglar. So see. So
Wait, do that again because that was actually hilarious.
What? yeah. Well, who is this driving a Tesla one? Who is this?
It's Dr. Core.
Oh, is it?
Yeah, that's Dr. Course.
Look at it. Little dog.
It's Dr. Core. So everybody's here. That's our. They're waiting. I can.
So once the residents
In the front. Yes, it's dual capture.
hello.
So we're gonna check. This is Dr. Back's surprise retirement party.
Okay, surprise.
Surprise.
We're saying surprise. We're saying surprise. How are you recording it?
It's, I don't know, it's just part of the new features for dual recording.
When you guys see him come in, you gotta be.
Not sure. Everybody could be seen. This is the behind the scenes. These are the third years. Third years. And Fraser Joseph. We're waiting for Dr. Back. They're backing up. They're backing up. They're backing up. It's the right car.
No, I told her she received my message and said, you can turn around and look at the red car.
It's coming. It's coming. She's parking here. That's Dr. Back. She's arriving. Everybody's ready.
Anna!
I'm dual capturing Dr. Lubin. Oh, I probably be here. No, we're saying not surprised.
It made no sense. Why I'm wearing a tie? So I've learned. She says put on a tie. You're lying, but basically.
These are from Chicago.
That's a real surprise. I'm speechless. Oh my! I feel like my life is like, floating by. Oh my! Oh God!
Yeah.
I think this is like some sort of a kind of cosmic.
What you're seeing floating by sometimes is just the sewers of Paris, though. That's all it really is floating by. Congratulations.
Wow. There was when I was in the cafeteria, I got a piece of pizza, and the woman at the cash register said, who I know, said, I thought that I saw a cake for you. I said, well, that doesn't make much sense. And who was it? I now know how she saw a picture of the cake from last week that the nurses gave me with the best saying, which was something like, congratulations, it's not my problem anymore. I'm retired as someone else. Wow. I am truly blown away. Wow, thank you guys. I'll think of a speech later. Thank you so. Wow. Karen did really well. She's not really keeping guys. She kept saying yeah, it's this pop-up farm-to-table thing. I don't really like that. I said, well, just make sure there's something I can eat. The pig roast is just not going to work for me.
For sure you would see through that.
No. I've always wanted to do this, so you're okay. Okay.
With the breeze.
The breeze smells smacking me, the heat.
Who's paparazzi?
Paparazzi. You wouldn't be safe if you had that job in Hollywood.
Next time, rain check or something.
Back and mass.
Hello and good evening. For those of you that don't know me, I'm Dr. Mack, and I'm here to talk about Dr. Back. Yes, we know our names rhyme. We've actually gotten quite a bit of mileage out of that teaching together. And I don't know if he'll even remember this, but very early on in my training, it was a bonding moment. I was on an OB rotation, and he was known as the OB guru faculty member. We entered a patient's room, and she was laboring loudly. So we waited for the contractor attending. I'll be with you for your delivery. My name is Dr. Back, and this is Dr. Mack. I took my cue. I did it. And we kind of did this little, our eyes met, and we kind of did this little 1 second. We thought we were being subtle, but she definitely caught on. So she goes, do you guys think that that was funny? And we did.
I used to tease her during sections that she was Mac the Knife.
That's how I knew he was one of my people. We formed that bond very easy, very early on. And I get to see over and over again how quickly Ephraim forms bonds with everyone around him. The people that he educates and trains have special bonds with him. He has this way of megaphoning us, even for those who are very early in their medical training. He introduces them always as doctor. He's very careful with our perspectives and our intentions as young physicians. I used to be one of those. And I've seen this special skill in him called megaphoning. I call it megaphoning because he doesn't really step in and add his extension of thought. He actually takes what was said, makes sure it's said again by someone reputable, him. But then he always turns it back around and gives credit to the person who said it. I'll give you an example. We were in a intimidating situation doing some advocacy work at the Capitol, and it was a controversial topic. And there was a younger physician in the room who was a little timid speaking to a senator. And he also did not agree with the topic of conversation that we were discussing. As she spoke, the senator actually looked to Ephraim for validation and opposition, almost like, can you believe this? He took in those nonverbal cues and he said yes. And not only does this doctor say very well what the issue is, she's actually an expert on treating patients in this situation. Senator, you should ask her what that feels like. In one fell swoop, he readjusted the senator's reactions, opened him to new information, and fully credited the other doctor with that expertise. I know that Ephraim naturally megaphones women and people with voices less easily heard. And this is amplified because he has spent decades beside someone equally grounded, fiercely independent, and deeply committed to other people, his wife Tara. Their shared kindness has led to a natural ability to build people up and diplomatically affect a professional situation. And he most certainly is a pro, a professional in many ways. He's an amazing physician in his own right, but he also can educate people to become great doctors as well. He can treat women in labor in a delivery room with amazing care and turn around and provide LARC in the office for a woman who doesn't want to deal with an unplanned pregnancy. He's able to treat people with substance use disorder with dignity and respect, but then can turn around and preach preventative strategies in a well child visit. I've seen him in full PPE during some of the most uncertain times of the pandemic, making scared nurses laugh with antics on walkie-talkies. He would don these gowns, and you have to bear with me, but we used whatever fabric people had available. So yes, I have seen Ephraim donning a gown with puppy print in full command of a situation. And honestly, it actually was inspiring. I've even watched him climb into a car with an N95 mask on in full PPE when the hospital wasn't willing to take blood from patients during that time. He was going to continue practicing excellent medicine no matter the barrier. On more normal days in family medicine, he's well known for his abilities to expertly adjust a prior authorization denial. And his favorite, he can develop a 1,000-word response to a radiologist he feels may be hedging, even if the entirety of that doctor's report was about 30 words. Sorry if there's any radiologists. These are the reasons that he is who we go to when we're frustrated. And when we do, he provides a recalibration. He doesn't do this by dismissing the issue, but remarkably, he is less upset about it. Let's think of a few doozies that he's had to deal with, and they roll off your back. I don't know. Need to address a gap in care in a small town, but the only way to do it is to go all the way to the New York State Department of Health and get the leadership to agree? Okay, it'll get done. Have a whole new residency program ready to go and still getting faculty onboarded? Okay, it will get done. Need to go through thousands of residency applications and determine which of these are going to be good doctors based on numbers and demographics alone? Okay, it'll get done. And it does get done. Some of us around him have doubted a shared situation, but we've never doubted him in it because he gets it done. He has been New York State AFP's Educator of the Year twice.
Wow.
And as I remind him, he's not even dead yet. He deserves it any and every year, and this is a look at why. He trained on the reservation. He's raised 2 children who both became family physicians. He has been a beloved core faculty member for me and others, supportive faculty colleague. He's been program director at Kingston, and then built a new program into existence in Saratoga. While all of this could just be seen as lines on a resume, it's more than that, because all along the way, he connected us. How many people in this room have had this conversation with Dr. Back? Hey, do you know so-and-so? You should talk to them. They would really like to talk to you about this. So yes, I have had numerous conversations that have started with a very awkward phone call. Hi, it's Kristen. You don't know me, but Ephraim told me to call. But we find exactly what he thinks would happen happens. We connect. And the projects, research, support, friendships that have started this way must be countless at this point. The influences of his connections ripple in every direction. And it's beautiful. I guess when I think of Ephraim's influence, I could describe it as ripples, but it is maybe more appropriate to think of it as wake. Wake is much more intense than ripples and more fitting because he doesn't just drop some knowledge or fix a problem, he drives us all forward. He is momentum. Imagine him cutting through water as he wins. I have not done this particular activity with him, but I have been swept up by his momentum. And I remember specifically a wild moment where I had to beg him to slow down. There was a particularly intense day on inpatient medicine. We were in a terrible situation. We had to convince these surgeons of our patient's very grave situation. But this patient was a regular and was stigmatized, stymied by some of the systemic issues that our hospital system and our biases faced. This person wasn't getting an appropriate response, a response that any other human in a life-threatening neurological surgery emergency would have gotten. We had a spirited session with neurosurgery in the ICU, and then we started rounds late, only after the patient was finally wheeled into the OR. Rounds were always rapid fire with Ephraim, and there were no breaks. But when we were almost done with all the other patients and trying our best to keep up with his long strides down the hallway, I finally lost it. I still wasn't processing the barriers that we had come up against that morning, and I ran to catch up with him. He quickly saw that I was struggling with what had happened, and I asked for a quick debrief. Next thing that happened actually was pretty funny because we were all trying to keep up with him, and so he immediately turned around really fast. We all ran into him. But we were right next to a conference room, so he shuttled us into the conference room, and we talked out some very serious issues. Stigma, barriers, our own biases. All of this probably lasted less than 5 minutes, but it was impactful on many of our careers. A moment we remembered because of how he role modeled and expertly balanced that situation. He didn't coddle us, he didn't dismiss the event or the emotions surrounding it. And when we sat at that table with him in the conference room, he didn't actually look rushed. He looked completely relaxed. He gave us focused attention with intention and without the pressure of a clock. Once satisfied though, we were back out the door at 60 miles per hour down the hospital hallways. So yes, he is momentum, but he is not frenzied motion. There's direction, intent, and the ability to apply the brakes. He just rarely has to. He has quick wit, thinks fast, and feels strongly. But he brakes when it matters. For me, he waits for me to get down the mountain when we're skiing, and he waits for humanity, those moments that matter. He's willing to go to other places that other people avoid. He talks politics, he talks religion, he may drop the F-bomb at a stat movie. He can somehow be emotionally fearless and also willing to feel deeply at the same time. And it's actually fun to look back at some intense moments that I've experienced with Ephraim, both professionally and personally, through the years. I told my husband, Evan, that Ephraim has a way of sending a lightning strike through my spine. As a resident, if I was really worried about a very ill patient, I would go to him to review my treatment plans, looking for reassurance like residents do. And at first, Ephraim would put me completely at ease. He may even wonderful medical decision making. But for those of you who haven't trained with him for as long, maybe you don't know that then there's a pause before the lightning strike. After which he says something like, I mean, if you're wrong, what's the worst that can happen? Yes, I would go back and do everything again. I forced myself to think harder and prepare better. That's the thing about Ephraim. The lightning strike stays with you, and somehow you end up better because of it. You are special because you've driven us forward, but you're also willing to stop with us and be present and impactful. It's why your patients love you, and it's all why we're all better because of you. I am confused a little bit though, because everybody asks me if I think that he'll ever fully retire, the third retirement. For some reason, very few people can imagine him retired completely from clinical work, but I can. There are few doctors as good as him, but he is a good doctor because he's a great human. Our favorite parts about Dr. Back will not be lost when he lays down his stethoscope completely. He and Tara will remain a force in the ecosystem that they've created, where they provide provocative questions to recalibrate us and then support and propel us to take our next steps. Those awkward conversations we've all had that he's pushed us into, they've made relationships that are long lasting. And those extra checks backs on our medical plans after a lightning strike, they've made us better doctors, nurses, and humans. His last several decades have led to countless changes that have literally made the world a better place. So now maybe you can see what I see. You can imagine his momentum as wake, too. Beneath him as he windsurfs, hopefully, doing more of that when he's less time in the office. And even when the time to join a procedure, he will be somewhere making wake, and all of us will be doing what he taught us.
The real pleasures of what I've been able to do is work with Kristen as an intern, and then sort of keep up with her in between. And then she didn't say this, but she was my boss in Ticonderoga. She had to actually put up with some of the stuff that I'm not sure other bosses would put up with. And so, the way of, the ability or the opportunity to kind of see and sort of change that relationship. And as you know, a lot of people don't call me Ephraim. It's still hard. Dr. Petrillo, who I shared an office with for 10 years, still calls me Dr. Back. A ton of appreciation for anybody who can call me Ephraim and even pronounce it correctly. That's my wife. She doesn't call me Dr. Back anymore.
It took a while, but I knew him when he was a chimney sweep. So I'm Tara, and I've lived on the other side of Ephraim all these years, and it's actually incredibly lovely to see you all gathered because I think all of you have given him really such joy and pleasure in the work that he's done all these years. Maybe some challenges as well, but joy and pleasure. Our children couldn't be here tonight because they're actually coming in 2 weeks. Josh is going to do ultrasound training, and Rebecca's going to help out in the sim lab, and I think both of those are going to make Ephraim very happy. But Rebecca asked...
And we just recruited her to do a lecture on IHS and public health.
He's shameless in my impression. So Rebecca asked if I could say read something on her behalf. So if you can just imagine me 30 years younger with straight blonde hair, kind of like, pardon?
Who's Rebecca?
You're Rebecca.
Oh, I know who Rebecca is.
Rebecca.
I'm her father, right?
Yeah, straight blonde hair, kind of like Kristen, actually, that would work. And I'll try and channel Rebecca for you. So as Rebecca says, she wishes that she could be here in person, but she's coming to visit her parents in just a few weeks. My dad is going straight from medical work to grandparent work, where he'll now be hosting our annual grandparent summer camp for her 2 kids. Like for many of you, and I'm going to speak in Rebecca's voice, my dad has been a formative mentor for me. Let me paint you a picture of how he has both supported and taught me. And it was really interesting, Kristen, you're starting off with OB, because I think that's been such a love of Ephraim's, and it's definitely affected Rebecca as well. One of my most harrowing moments in medicine was my second night of internship. I was working on labor and delivery, and a woman had just delivered before my shift. But through the course of the night, her uterus kept distending despite no obvious bleeding. Something felt off, and I called my attending about 3 times that night. But each time, my attending reassured me that there's no obvious bleeding, the patient will be fine. The next morning, a new attending came in, recognized the medical emergency that was happening, and brought her to the OR where they evacuated a lot of blood. The woman stayed in the ICU for a few days, but was ultimately, thankfully, discharged home in good health. I remember driving home that morning, bleary-eyed, and sitting in my car in front of my apartment. I felt awful, but I didn't know what I could or should have done differently. And so, I called my dad, like I would for so many other moments throughout my medical career. We talked for a long time, and probably in a few more phone calls after that. We processed the evening, both medically and emotionally. And that was my dad's first lesson to me about the art of medicine. He taught me that even as new as I was in my career, I should always take into account my gut feeling. He also shared that if he were the attending, he would have come in after that second phone call. If a junior doctor is calling you with obvious concern, just come in. Best case scenario, nothing was wrong. And he helped talk me through how to manage a postpartum hemorrhage the next time I saw one. Each of these lessons has strengthened me as a doctor and a teacher. In fact, I regularly teach my students that no matter how junior they are on the team, their insights matter too. And I've never forgotten to integrate that quick gut check in my medical decision making. Luckily, with time, training, and practice, my gut check has gotten better. After residency, I moved out to Zuni to work at their Indian Health Service hospital, a small rural hospital in northwest New York. Not New York, Mexico. Way far away, too far away. Choosing to work with Indian Health Service was largely influenced by my having lived on the Navajo Res when I was a little kid, because my dad worked at the Indian Health Service hospital in Fort Defiance. In Zuni, the hospital was run by primary care doctors, with the closest specialists at least 45 minutes away. And at night, there was one doctor on call and one doctor available as backup. So, as a new doctor straight out of residency, you can imagine it was pretty scary at times. Fortunately, my dad was used to training residents, and with teaching residents comes a lot of late night calls. So I called my dad a lot during the first few years. And despite the 2-hour time difference, or that I was often calling at 3 or 4 in the morning, my dad always answered and would talk me through cases. Initially, the cases were probably fairly bread and butter, but I was too inexperienced to recognize that. And later, there'd be times when my dad would listen to me present the case and suggest that, wow, this was complicated. And it's not unreasonable to call the on-call specialist through the New Mexico hotline. As I got more experienced and honed my skills, my dad has lamented to me more than a few times that I never call him anymore in the middle of the night. So Abba, as Rebecca calls her dad, thank you for not only being my dad, but also my mentor all these years, for helping me develop my own art of medicine, for teaching me how to become a good teacher, and for instilling in me a passion for both clinical medicine and public health. And for all of your advice about my next career steps. Usually unsolicited advice, but I'll mostly take it.
It's your first delivery. I think it was take your daughter to work day, and she was really excited. And the intern forgot to clamp the cord, and this woman is like this cord is like exploding blood, and it was memorable. I still remember.
I'm Colleen Quinn. I currently am the Associate Program Director with Ephraim, but I am standing here to read for a statement that John Petrillo wrote, who could not be here today. And so John and Ephraim met, I just realized I always call you Ephraim.
As you should.
Met back in 2001, and he was initially a student, and then was a resident, and then became a faculty member. So they worked together for a very long time.
When he first came as faculty member, they gave him a broom closet for his office. And I had this big, spacious office, so I magnanimously said, John, come on. So we shared the office and we shared music. They still go for that.
So there's a gift I was given by a former resident that hangs in my office with the quote, "A teacher's purpose is not to create students in their own image, but to develop students." There's debate as to who the quote is attributed to, but it is ubiquitous when you go researching quotes regarding teaching. When I think about Dr. Beck and the history that we have shared, this quote resonates with me as it describes what I came to experience in being here for part of his amazing journey. I have considered myself lucky enough to have advisors, confidants, and teachers along my own journey. I'm certain it is something many folks in this room may have had the fortune of experiencing as well. Yet, it is one thing to be a teacher, but to have a true mentor that is a whole other ballgame. To the fact that he took me on as a student, even though he didn't want to because it was the month of July. To the fact that he, along with the rest of the faculty at St. Clair's, had to deal with guiding me through my residency program. To the fact that he exposed me to experiences he thought I should have to help make career decisions that best suited me and my family, even though it landed me ultimately in the very same place I began. To the fact that he brought me along on the road of teaching others when I joined the faculty, even moving me out of my Harry Potter-sized closet office. He literally and figuratively created space for me to be with him and to learn alongside him and the impact that he had on me. Though perhaps small, in his eyes was deep. He never just gave me the answer. He showed me the importance of the curiosity, the humility, and the process of learning. Successes, failures, and everything in between. I sincerely cherish the time that he has always made for me and hope that I can bring even the smallest percentage of what he has given me to someone else along their journey. I don't know that I necessarily have that yet, but I will keep trying. I thank you from the bottom of my heart. I congratulate you on an incredible career. With love, respect, and admiration, John Young Grasshopper.
Look at the cake behind you. That was made by Grasshopper and Mrs. Grasshopper. The reproduction of the cake that they made for me during my first retirement. I think it was Starla who's got a note from him about the cake, right, Starla?
I do.
Why don't you come up here so we can hear you? And this was the cake that apparently somebody in the cafeteria saw, and they mentioned to me at lunch, and I didn't know what they were talking about.
They only see the cake, not the head.
Oh, they didn't see the head?
Okay. So he said, after you see the head, no, this head is not smaller because they are trying to mimic any reference to shrunken head tribes. So it's always a lot bigger and kind of wider. Figured Dr. Murphy would say something, but we legitimately ran out of Rice Krispie treats. We figured really nothing's changed except maybe just a little more gray in the beard than before. Love you much.
Everyone wants to start eating, we can start.
I would like to say something. Thank you for allowing me to prepare. One of the things that's always interesting to me, what I really appreciate about Dr. Petrillo especially, is telling me stories about myself that I have absolutely no recollection. And so that's true for Kristen's stories today. I have absolutely no recollection. So I really am hoping that you'll come to my funeral, but not anytime in the near future. But Kristen remarked on something which has actually been, I think, the thing that has been the most pleasurable part of my career, which is bringing people together. And so Rebecca, my daughter, is looking at a new job, and it's going to be at CDC, and Dr. Pratt, right here, who I met when he became the Commissioner of Health in Schenectady, and he came over with his marble notebook, and I adopted, and a couple of other folks in our entourage have adopted the marble notebook. So Dave Pratt and I stayed together after, during Commissioner and afterwards. And then when I took on this job as Saratoga Family Medicine Residency Program Director, he said, you've got to meet this, because he's also like that, you got to meet this young doctor who does cancer epidemiology at the state. And so Heather Dacus, who you guys have met, came over, and it has been a pleasure. And I introduced some other people who she's worked with. And so when Rebecca called me 2 days ago and said, I'm looking at cancer epidemiology, I said, I've got just the person. I met with Rebecca yesterday, and then today she met with Anna because they're doing a project together. And that's the beauty of this integrated network of doctors and healthcare people that we all have together. So I'm really kind of blown away by Starla's ability to even figure out who to invite from all these different areas of my life. Jen, who I, was a resident of mine, 25 years ago?
2000, class of 2000.
Class of 2000, yeah. It's just Dr. Greenberg who brought us Yelena, You're going to pay for that. I'm really blown away. I'm very, very, kind of very appreciative. I also realized when I was listening to Kristen's talk that the last couple of years have been kind of a little harder for me because I have not done all the other medical stuff that I used to do. And that's what I really prided myself on, sort of being full spectrum OB and inpatient ER. And I really encourage certainly our young doctors, do as much as you possibly can, because it's what really is the fun in medicine, and it really kind of adds to. I told Dr. Borgos last week that I delivered close to 1,500 babies, and they weren't all great deliveries, but one of those babies was born 27 years ago, and my very last day in clinic, last Friday, she came to us because she knew that I wasn't taking patients anymore, but her mother, who was quite a character, I remember that 27 years ago, her mother said, well, go find out where Dr. Back is practicing, and I'm sure that it's a good practice. And that's exactly what she said. So she's now seeing, oh my God, who is she seeing? They'll come to me, I'll tell you. One of our younger colleagues.
I think Farhan.
She's seeing Farhan.
I think so.
Yeah, that's exactly right. So it's been an amazing, really, really incredibly fun career. And to your point, Kristen, it's not quite over. I have to figure out what the next step is, and I'm looking forward to another party. I'll invite a couple more people, another cake. It'll be a little smaller, it'll be a little grayer, but it'll be okay. I'm so appreciative for you guys to come here tonight, so thank you. I'm looking around, I keep seeing people who I hadn't seen before. Julie joined us from Kingston, and Salam's from Kingston, and Stan's from Kingston, so that was a whole other folks from St. Clair's and from Ellis, and my new community up here in Glens Falls, and Ticonderoga, and Saratoga. What's that? Oh, you did a good job collecting. So it's been a total pleasure, and the fun about it all is that I've been honored with this Educator of the Year award, and I don't see it, frankly. It's sort of just the way I do it. Colleen wants me to give you the way to do it, and I have absolutely no way of knowing how to do it. So, and if in fact you appreciate the way it's done, I appreciate that, because it can never be reproduced. So there's something that must be happening sort of about it, and I hope it's working out okay, because once again, I don't remember it, and you seem to sort of appreciate it. But if you do make mistakes, blame it on me, because that's totally fine. I told it to Rebecca too. She didn't put that in her little piece. But if it doesn't go well, say, I talked to my dad. He's just a family doctor. So, anyways. And then, of course, the fact that my two children are coming to help during orientation is just absolutely amazing. Although Rebecca spells her last name wrong. But that's a different story. So Rebecca's coming in 2 weeks to talk about Indian Health Service and PHS. So certainly, if you have an opportunity, come and listen to her. Alina, I had the opportunity to spend time with Josh at Zuni, and Megan is going out there in about 6 months or so. Maybe. So there's lots of opportunities. There are lots of cool opportunities out there, and certainly making the most of them is really good. Although probably best not to sort of participate right now in the whole disaster. We'll wait a little bit for it. They get the personal protective equipment in place. Okay, that's all I'm going to say. Because I can keep going.
It's like the wedding.
I'm a stingy cake cutter.
You are.
I'm trying to keep people sort of help them with their BMIs here.
Please.
You got it.
With cake duty, if you don't want to do that.
I'm going to do the first one, and then you can do that.
I'll do the rest.
Thank you. I'm glad you have some usual skills.
Congratulations.
It goes through. I don't know why I'm acting like I